I won't spend a lot of time on these slides because it's all probably fairly commonplace to most of you here, but this is what we now know as very like a prolonged post-viral illness due to persistent changes within the immune system. And we get every type of person with this, from very, very severely ill, people who have to be in a darkened room, unable to care for themselves, needing tube feeding, right through to people who are almost not far off 100% of what they normally would experience in good health. And obviously the people at the top end often are working or studying or living a very normal life, whereas the people at the bottom end are living a very abnormal life. It's probably, in the majority of cases, have been triggered by an infection of some sort, and they have now found that the so-called metabolome, which is all the body chemistry, is quite disordered, as well as disorder of the immune system. The immune system is very inflamed, and also there is evidence of what we call glial inflammation. Now, some of you may not know that glia are white cells within the brain that become very active and inflamed. For example, if you get a bad attack of flu, these glial cells become quite sparkly and active. And this is what makes you feel ill if you get the flu or a bad cold. You feel tired, you feel unwell, your blood cell count changes, your white cells increase, you probably ache all over, you may have a fever, and it kind of is almost saying to you, hey, you must go to bed, you must rest. And this is the sort of glia sending messages to you. And if you give in and rest, then recovery from, and I'm not talking ME, I'm talking recovery from flu or colds and things, is very much more efficient. Whereas if you try and keep going, it takes that much longer for recovery and the recovery of the glial cells. And I think this particular type of work is being very much more worked on and obvious now in the whole ME saga. And the main symptoms I'm not going to go through, because those of you here who have either got ME or have a relation with it, you know and understand the symptoms, and these are very clearly documented. There's a whole list of there, and this is what I'm going to rush through, really, to give Warren time to give you his take on it all. But there is research going on in all these different areas, and there's probably research in other areas too, but certainly the research is being performed by extremely high-powered teams, places like Harvard, Stanford University, London, other European centres. Certainly we're very lucky to have Warren here in Otago because he's widely internationally recognised. And some of the research going on in Australia is very, very valuable too. There's a team up at Griffith University in Queensland who are doing some incredible work with the immune system, and they've just started about just a week or 10 days ago, calling for volunteers to do some drug trials. So that's all very exciting stuff. So again, I'm not going to spend a lot of time except just to say these things. These are just some of the types of research that are going on. Identification of genetic changes. You may wonder what telomeres are. Warren will probably cringe when I try and explain because he's far more of an expert in this area. But telomeres are little sort of spikes on the chromosome, and they've shown in some of the research that these age more quickly in people with chronic fatigue syndrome, ME, and this may mean that aging and longevity are affected. Though again, there's no real total proof on that. And the other interesting one is that the gene that they have found that relates to sleeping sickness, which is caused by the tsetse fly in Africa, is certainly very similar to the ME gene. So they're actually beginning to look to see whether some of the old-fashioned drugs that were used in sleeping sickness in Africa could be relevant to ME. The metabolome is the metabolic changes, the different chemistry changes in the system. And again, I'm not going to go through a lot of detail, as we'd be here all day, all night. But just to say, these are some of the things that are being looked at, and they have found particularly the bottom lot and the top lot have found that the changes in underlying body chemistry are very different in people with ME, and this could be the basis eventually of some sort of diagnostic testing. And they liken the changes to an animal who's hibernating. So that's quite interesting too. And I've often said to my patients, well, maybe if you crawled into a hole for 6 months, it might make a difference. Just a kind of comment, really, but hibernation, of course, is the animal goes to sleep for a very long time and their whole body sort of shuts down, and that seems to be what's happening to a number of people with this illness. Changes in the chemistry too, which is relating to what we've just said. One study has shown that despite the fact many people think that they might have mercury toxicity from their fillings, and Hg is mercury, that they might have toxicity from the mercury. Some of the research now is showing that there's no increase in the studies that have been done in the level of mercury in the system of ME people. I mean, obviously they haven't looked at thousands, but those that they have looked at. Blood, hematology is looking at the blood. And some of you remember that way back, not so many years ago, maybe 20 years ago, 15, 20 years ago, Dr. Les Simpson down in Dunedin was doing study on red blood cell shape and movement and did find abnormalities there. The research was never probably followed through and completed at the time, but certainly now they are looking much more at red blood cells and finding that they do seem to be stiffer and flow less freely, and this may relate to some of the lack of oxygenation of brain cells and things like that we hear about. This was an interesting study though. They found that if they put, and they're talking blood cells here, if they put ME cells into healthy serum, healthy plasma. Serum and plasma are the liquid that the blood cells float in, and if they put ME cells into healthy serum, this was in the laboratory of course, the cells seem to behave quite normally, but if they put ordinary, everyday healthy cells into the serum and or plasma from ME patients, the cells changed and behaved abnormally. So it was as if in some way the ME serum is in some way damaging the cells, maybe. And all these things, they're not conclusive, they're not finalized, but they're just giving people ideas of types of work that could be done. Virology, of course, that's always being looked at. I think the third comment down there was, quite surprising in that the man from Stanford, Ron Davis, who you've probably heard a lot about, he had found that when he looked for viruses in people with chronic fatigue syndrome, and we're talking viruses that may be active and damaging or needing to be dealt with, he found that actually the healthy people were carrying far more viruses in their system than the non-healthy, the ME people. So that was interesting because a lot of us, me included, have used antivirals, antiviral being the viral equivalent of antibiotics. We've used antivirals to try and treat people with chronic fatigue syndrome quite haphazardly sometimes, because often the patients are requesting it and desperate, as you can imagine. So the encouragement now is probably that for the majority of people, antivirals are not going to be doing an awful lot. However, John Chia in the USA, he has found that a particular cohort or group of ME people do have a lot of gastrointestinal symptoms, particularly in the stomach. And for the last probably 5-6 years, he's been doing stomach biopsies and finding that he has grown a particular type of what we call enterovirus, which is a stomach or intestinal virus, in quite a few of his patients who've had those sort of symptoms. And he's treated them with what he calls oxymatrine, which is marketed as equilibrant, and it is certainly helpful for some people. It's actually sourced from a Chinese herb. Immunology, there's a lot of study and work going on, particularly from Nancy Klimas and Miriam Fletcher. That's the team in Florida. They did a lot of the early research in immunology, and the work carries on. Miriam Fletcher is a very well-known researcher in that she was one of the first people that devised a test to prove that a person was suffering from glandular fever. So she's a top researcher, and Nancy Klimas and she work along together in Florida. However, the interesting one is the bottom one, the TRPM3, which is being looked at by Dr. Don or Professor Don Staines and Sonia Marshall-Gubiznik in the Gold Coast. And probably Warren might be the only person in the room that actually understands this, because I don't. But this is a particular, you don't need to try and understand it, but they found a particular abnormality in the control of the way calcium moves in and out of cells, and every cell in our body needs calcium. And they have found this abnormality, which they call the TRPM3, and this affects every system in the body, and they feel it's highly relevant to the whole underlying pathology of this illness, and would help explain too why so many symptoms occur, and the symptoms can be many and different. They don't advocate the idea of people suddenly swallowing lots of calcium, because that doesn't fix it. And there's a drug called nifedipine that they've looked at, which does involve the way calcium moves in and out of cells, but as yet that particular drug hasn't been found to be particularly useful. But they're moving on with this research, and it may, as many forms of research, fizzle out, or it may be the final breakthrough that everyone's looking for. We never know at this stage. It's too soon to comment. Their treatment trial now, they've just started, or calling for volunteers, looking at using low-dose naltrexone, because they have found that this has influence on that particular mechanism too. So this has all just come about in the last couple of weeks, really. The microbiome, which is the contents of your gut, all the many bacteria and viruses that are floating around in your intestines, millions, trillions of them, and we probably only know of a very small percentage of them by name, because they're almost, discovering new viruses all the time. But that just shows you that there are various places around the world that are looking at all this, and there's quite a lot of interest in things like fecal transplants now. Not something you go rushing and do with your next door neighbour, but they are finding, there's a doctor I know in Australia who's using fecal transplants, all done very scientifically and carefully, and finding some moderately good results. So again, it may fizzle out, but it may turn out to be a form of treatment that could be of use. Most of the research too is indicating now that probiotics are not particularly useful in this illness. They might be useful if you've had a course of antibiotics, or if you've had a severe gastrointestinal infection of some sort. They help put back what might have been lost by those things happening. But generally, just swallowing them for the sake of swallowing doesn't seem to make an awful lot of difference. Though I have had patients who've said, yes, as long as I take probiotics, I do feel better. But it's, again, it's not a proven thing that everyone should rush off and do. And most of the people who had studies done on different diets that they've used, we haven't found that any specific diets is particularly important for this illness. There will be many people, of course, who do have specific allergies or sensitivities, and that happens out there with all the other non-ME people too. So obviously if you're gluten intolerant, you avoid gluten. If you're lactose intolerant, you avoid lactose, peanuts, and so on. But they haven't found that a specific diet like the paleo diet or the this or the Stone Age diet or anything has particular obvious benefit in this illness. Main thing is to have a really good range of nutrition. I won't go through all these brain studies, but there are a lot of brain studies going on all around the world, particularly Ben Natelson and Gudrun Lange. They're people in America, and they both work, they're a husband and wife team, but they're both very highly regarded researchers and clinicians who are doing a lot of the brain work, and all these different things have been found. And, you know, when you just look at the list, even if you don't really understand it all, it helps to explain why so many people have so much trouble with brain fog and sluggish thinking and so on. And then the exercise studies, of course, too, are very, very significant and considered almost the gold standard, the so-called 2-day exercise test, to help make a diagnosis of this illness, because it shows that, you know, you could go on an exercise cycle, for example, the first day. Might be a bit gruesome for you, but you try hard and you achieve quite well and your system manages to cope with it. But if you're then taken back 24 or 48 hours later, you might not even be able to get on the exercise cycle. It's this so-called post-exertional malaise, whereby the body seems to rebel against too much physical use, and it's thought that there are probably abnormalities in the muscle cells, the mitochondria, and also the other thing that probably contributes to it is what we call POTS, which is orthostatic in tachycardia syndrome, postural orthostatic tachycardia syndrome. It's always such a mouthful. It's easier to say POTS, but POTS is that feeling that if you get up suddenly you're very woozy, or if you exercise a lot you may find that you do get, you know, your circulation doesn't get up to your brain and you can begin to feel quite ill. Lots and lots of symptoms as a result of that, and it all ends up in this what they call PEM now, which is post-exertional malaise. And the post-exertional malaise and the cognitive or brain deficit would be the two main reasons why people are unable to work usually. Sleep study is very important. There are a lot of sleep deficit problems. Most people with this illness will have some sort of sleep problem. It may be that they can't get to sleep. It may be they're wakeful. It may be they sleep on, and some people with this illness will tell me, I sleep for 18 hours and I'm still not refreshed. And there seems to be a lack of what we call deep level 4 sleep for most people, and that would normally be the sleep that would restore and refresh you and help your body recover. We'll move on a bit. Biomarkers, well, I'm not going to go into in great detail. Everybody's yearning for the biomarker, and many of these things that I've already mentioned today could well end up being the important biomarker in this illness. Again, you know, there's no set blood test you can yet go off and get done, and many of the things that are being looked at are not simple tests that you can just run down to the local lab and get done. Most of them would require extremely high-powered, expensive laboratory equipment, which may, for example, only be available in one centre in the world. So we're nowhere near popping off for a blood test, but certainly the work is all beginning to lead towards it, and that's very, very exciting. A few drug trials going on. Those are just a few of them that are being done around the world, and probably the latest one, the so-called low-dose naltrexone one being done in Queensland is worthwhile, going to be possibly worthwhile. And the Norwegian studies are looking at another chemotherapy drug called cyclophosphamide, which used to treat breast cancer, does have very nasty side effects, and they will be reporting on their studies in May in London. It could be that this could be a breakthrough. There was the work being done before on other anti-cancer drugs, which rituximab being the one which hasn't been proven to be successful, even though they were full of hope. But this one they feel actually a little bit more hopeful about. I've mentioned the sleepy sickness drug, the one that they use for myasthenia, which is a neurological disease. There have been some patients who've done really quite well on that. I've had a few patients over the years, it's not a new drug, who've actually improved a lot. We find, that some patients will do well on one thing, but not everybody does well on the same drug. And this is probably because in the end, we're going to find that the term, let's say, chronic fatigue syndrome or ME, is a bit of an umbrella term with lots of subcategories. And depending on maybe the symptom complex or the category that you happen to belong to, that particular drug might then help you. So we just don't have all those answers at our fingertips yet, but some of the genetic work by Dr. Jonathan Kerr in London did show that there were probably 8 different subcategories of people with this illness, and that may well in the end relate to some of the treatment responses. This is Warren's slide, so it's a good introduction to him. I don't know if you'll be using it again, but it's such a lovely slide. I have to always put it up. But the jigsaw is beginning to come together, and some of what Warren's going to tell you in a few minutes might put in another piece, hopefully.